Well, youth sports is not what it used to be. The level of competition, the amount of practice, the intensity of the game. It's all leveled up from even just 10 years ago. And what's also leveled up is the risk of injury. So here to give us tips on protecting our children is pediatric sports medicine doctor, Dr. Patrick Mularoni. Welcome back to the show. We always get great advice when you are here.
Thanks for having me.
Yeah, well, let's talk about this because, sports, especially youth sports, are so competitive these days. Obviously, it comes with some injuries. What types of injuries are you seeing recently?
We see injuries to all body parts, but one of the areas that's a big focus nowadays is ACL injuries, the tearing of that anterior cruciate ligament. And the crazy thing that we're seeing now is that women are having this happen 2 to 5 times more than their male counterparts who are playing the same amount of sports.
Okay, so I read a little bit about this. Why do we think that is? What do we know?
It's interesting. It's multifactorial, right? So there's several different camps of why this is happening, but it's probably layered the reasons why. I think the first one is that women's bodies are different. Women have wider pelvises, wider hips, so the angles on their knees are a little bit different. I think the second thing is we've recognized that the neuromuscular adaptations of females and when they land is a little bit different than men just naturally. So women, when I'm going to stand up and show you, but women,
let me see.
Many women, when they land in a valgus stress, so their knee will go into this stressful position. And if you land in that position, the tibia can push against the femur, and then that stresses that ACL. So landing more over your feet is going to be better than landing in that valgus stress. I'm just showing this on my right knee.
Yeah.
And then the third area of research that is just coming about now is that the menstrual cycles might have something to do with this. Men, they run on one hormone all the time. It's testosterone. But for females, there's different hormonal surges throughout the month, and we're starting to see that potentially ACL injuries are happening more just before a woman's period. So these female athletes have these hormonal changes that change the way the ligaments respond in the body.
Wow. And are we noticing this in all women's sports or just specifically like soccer?
Well, there are women's sports that have this happen more often. When you tear your ACL, most people think, oh, it's this big catastrophic injury, but it usually is a non-contact injury. So you're moving around, no one's hit you or anything, it's just the way you land or the way you cut. So soccer is one of those sports where you're in cleats, the foot can get caught in the grass or turf, but you can tear your ACL in many sports, and you can tear your ACL just, walking down the street and having it happen. It can happen.
So do you think that coaches need to kind of take a closer look at this and kind of help kids practice their landing, their cutting, all those different
Absolutely.
skills?
That and making sure that the athletes are warming up correctly, so proper warm up, and then practicing these things, practicing landings, that's important. So watching how your child lands, if you see your child's landing with a leg that is going into that valgus stress, what I just showed, or another way that it can happen is if they're landing on a hyperextended leg, so the knee's not bent at all. After a while, that injury can happen because you're playing so much that one bad landing and you can tear that ACL.
Wow, that's fascinating, the research there. Okay, so let's talk about some other sports like, baseball. What kind of injuries are we seeing in baseball, and what can parents do to kind of look out for those injuries?
One of the things that's been shocking is over the last 10 to 15 years, we're getting to a point of early sport specialization. So when you listen to a parent and you say, well, what sport does your child play? They'll tell you one sport from like 12 years old, 10 years old. We're not seeing those kids that are playing 3 different sports. So when you have these early sport specializations and they're playing year-round, never stopping, then you can get overuse injuries. So in baseball, we're seeing more shoulder and elbow injuries because these children are doing these same things over and over again. So an off-season is a good thing.
Yeah. So how do you tell that to a parent or a coach who wants these kids to work and to go from, high school ball to travel ball, and then it's nonstop?
Hard. Yeah. It's hard, and we try, right?
Right.
We tell them to train like a professional. If you look at the Major League Baseball players, there's a period of time every year for 3 or 4 months that they are doing cross-training, and they're the professional. So you should actually train like a professional. But it's hard because we have youth professional sport coaches, and that's their job.
Yeah.
And they want to do their job year-round, and the kids are having fun, and you just kind of get on the treadmill as a parent, and it's the next season, the next season, the next season. So what I think is a good idea is at least before high school, your children should be playing 2 sports. They should be playing another sport. And even if the kid down the street is playing baseball all year round, your child's not going to fall behind. They're going to catch back up right when they come back. So I think that multi-sport is a better decision for families than getting your kid in one sport, because that overuse can lead to injuries.
Yeah, great advice. Okay, what about, I want to talk about a concussion concussions real quick
Yeah.
in football and other sports. You know, what can parents do to look out for that and to make sure that doesn't happen?
Well, you know, shockingly, in our country, there are more concussions in soccer than there are football, but more kids are playing soccer.
Right.
Football has the highest incidence, and I think that the most important thing to know is to know your kid. You know, it's just because they play a helmeted sport doesn't mean they're going to get a concussion. But if a child does get a concussion, the things you're going to look for is obviously they've had a hit to the head or body, and then changes in them, headache, emotional changes. The most important thing to do is if you think your child has a concussion, get them off the field, sit them out.
Right. Just keep an eye on your child, right?
Exactly.
All right. Well, thank you
Exactly.
so much. Those are great tips. Really
Thank
appreciate
you.
it. Well, Miss